When it comes to medically supervised injecting rooms, I want to stress at the very outset that I have seen the damage that illicit injectable drugs can do in our community. I have seen the death, I've seen the destruction, I've seen the evils that abuse of drugs can cause to the individual, to the children, to family members, and indeed society in general. I am absolutely against all abuse of drugs, and in no way am I encouraging their use. I'm sure I have the support of all members in this chamber. But it's also an incontrovertible fact that people do abuse drugs and will continue to do so. Another incontrovertible fact is that people do now and will continue to use drugs intravenously. Prohibition has not stopped that, nor will it. People die. The highest rate of drug-induced deaths was observed in Western Australia for the third consecutive year. 9.9 deaths per 100,000 people. That's shocking, members. And worse than that, those 3 consecutive years seem to suggest we're not having a great deal of success in tackling the problem. We're already behind our neighbouring states and territories, and my fear is that if we don't learn the lessons they can teach us, lessons like the establishment of the medically supervised injecting room, either full-time or as a trial, we're going to fall further behind. Is there any reason why we in Western Australia would not want to see that sort of service rolled out here in Perth, when the evidence is there to show that it works? But the truth is, it improves and saves lives, and also the quality of life, which should be our primary concern, saving life. It gets people in to see the doctors, it keeps them out of the emergency department, and it improves health outcomes across the board. We need to have clear local data on overdose rates, clear data on emerging risks locally in Western Australia. So the motion before us doesn't ask for anything more than that, the consideration of the new data by the government and a report back to Parliament in due course.